I'm really delighted now to introduce our next speaker, Alice Popejoy, who is an assistant professor in the Department of Public Health Sciences at the University of California at Davis. So please go right ahead, Alice.
Thank you so much for having me. Looks like I have my pull everywhere here thing. Can you see my slides?
Yes, we can see them.
Thank you. You got a little preview here. I'm going to do things a little differently and have an interactive session. But I do just want to thank the National Academies so much, the committee, for inviting me. And I'm just so pleased to be presenting to you from my hometown in Sacramento from my new post at UC Davis as an assistant professor on the ancestral homelands of the Miwok, the Nisenan, the Maidu, and the Miwok peoples, who are the indigenous peoples of this land and have lived here since time immemorial. Today, I'm going to talk to you about my research on population frameworks that are currently in use in genomics research and clinical genetics, definitions of race, ethnicity, and ancestry, population descriptors in clinical genetics, and multidimensional data maps. So I'm going to ask you to do something a little differently. If you have your cell phones with you, would you mind just indulging me? Text my last name, Popejoy, to this number you see here, 747-444-3548, just once, and then you can join the session, or you can go to polev.com/Popejoy. And once you've joined the session, you can answer any of my prompts for the rest of the time today. Could you just write in what word or words come to mind when you think of a population? Give folks a minute. And for folks watching at home live, this is for you as well. This is a way for you to engage with the committee and have your input represented today. All right, they're rolling in and there's sometimes a delay. So group, lots of people writing in group. That's why it's so big there. Community, antiquated, location, ideas, parameter, race, kin. Okay, and you can keep those rolling in. It'll stay open until I get to another question in quite a while. So if you didn't get a chance to respond, please go ahead. So we all have different ideas of what a population is. We're talking about population descriptors, but I don't think we often pause to think about what a population really means. So I'm going to talk about population frameworks that are in use today, and we'll get back to that question of definitions later. I first got interested in this question of how populations are described in genomics in 2016 when I was working on my PhD in public health genetics with Malia Fullerton at the University of Washington. And it was really difficult actually to group all the different study descriptors that you see listed here from the GWAS catalog into categories, because many of them are sort of messy and you don't really know where to put them. And I just sort of really opened my eyes early on. Since then, the folks at the GWAS catalog, EBI Omble, have developed an ontology called the Human Ancestry Ontology, or H-Ancestro, which you can access on the Ontology Lookup Service, OLS, that sort of organizes things by ancestry and ancestry status, continent. There are different hierarchical ways of organizing information there. And there was a biogeographic grouping system that was sort of generated for pharmacogenetics research by Terry Klein's team and some of us weighing in here on Ancestry sort of defined biogeographic grouping system. So folks are trying to standardize populations or have been for quite some time. Now, these are the population descriptors that are used in GNOMAD, which is the database that is used most often by clinical geneticists, genetic counselors when doing curation to look for allele frequency data. So the populations are determined using ancestry estimation, but as you heard earlier, that can sometimes be a bit of a fuzzy process as well. And you can see that the sample sizes of those different groups are different. So when you're comparing point estimates from samples that have different sizes, you can run into some sticky issues and reliability. In the UK Biobank, you also heard from Graham Coop this morning. There are some kind of wacky categories coming from the US, looking at the groupings that they use. These are the census categories in the UK, and they are the same population labels that they use in the UK Biobank, which is used by many researchers as a reference population. Now in the US, don't need to introduce these race and ethnicity categories. You've all seen them. If you've lived here for any amount of time, I've been talking about them over the workshops and the committee. But what we don't talk about is how often we just refer to these types of categories as populations without really questioning what type of information we're actually looking at and whether we can really call it a population based on who it represents and for what purpose. So these categories that we have from the census have now been integrated into our electronic medical record systems, into healthcare forms, and they are not standardized by any means. This is something we've been looking at in ClinGen, the Clinical Genome Resource, for since 2017. I started the Ancestry and Diversity Working Group with Carlos Bustamante in the fall of 2017, and we have been looking at this question of how we should use race, ethnicity, and ancestry in clinical genetics. And as you can see, our working group is very diverse in terms of background, discipline, and expertise. So it's been really beneficial to have the members come together every month to discuss these issues. And what we learned early on is that we actually needed to do more empirical research to learn about how the categories are currently being used before we could move forward with telling people how they should or could be used. So the first thing we did was look at clinical lab test requisition forms, and we found that no two forms were the same. They had different categories, they were called different things, and there was really not a lot of standardization across the clinical labs by any means. And then when we extended this analysis and looked at labs outside of the US, it turned out that most of the forms outside the US didn't even have this type of information on them at all. And if they did, it was most often a blank text, sort of fill in the blank piece of the form rather than a sort of checkbox multiple choice. And outside the US, race was not used on any of the forms. I think it's really important to pause and just remember that classification of human beings is very old, especially in Western societies that have used systems of hierarchical groupings as mechanisms of oppression and genocide and extraction, exploitation. And as recently as the Jim Crow era, there was a very fundamental belief in scientific or biological racism, the idea that people needed different medicine because of the color of their skin, that there are some fundamental underlying differences that necessitated people being segregated into different clinics or different wings of the hospital, you might say. And we talk about this as if it's in the past. I think often we do that in science, sort of other these practices as if they were pseudoscience, when in fact at the time they were considered cutting edge. And I really felt inspired by this post. It was actually 2 years ago by a good friend of mine named Brian Prince, who's an athlete and an artist. I went back and I read this post that had a really strong impact on me 2 years ago. He said that being a marginalized person in America is living every day with the fear and discomfort that many white people only feel right now. And I'm just unfortunately used to it. If you're uncomfortable right now, don't forget how it feels, because this is how Black people feel all of the time. I personally struggle sometimes or often as a white woman working almost exclusively on this topic for several years now, and sort of thinking about my place. And I don't feel comfortable speaking for marginalized communities and their experiences and how it impacts their health. But I was curious to check in with Brian and see 2 years on what message he had for the National Academies Committee and the rest of the community. So we did a recorded interview on Zoom yesterday, and I think it was really good. So it's on YouTube. You can go to it here at the tiny URL. But the main take home is that he said he wants people to be better at feeling uncomfortable. that the mental pain means something and that it's a motivation for change. So I just invite everyone who's engaging with this topic, either for the 500th time or for the first time, to consider that the feelings of discomfort that may arise when we talk about these topics are very much integral to the process of change. So what do we really mean when we say race, ethnicity, and ancestry? What does the word race mean to you? If you would, please indulge me. All right, that's it. Racism and stratification. No, you can have probably 5 more seconds to chime in here and then we'll change the terms. Social groups, okay. All right, thank you. All right, how about ethnicity? Okay, social construct, exploitation, practices, repression, cultural groups. There it is. Culture always comes up. Okay, thank you. How about ancestry? Misleading, kinship, also culture, unequal treatment, family. Okay, picking up steam here. Thank you so much. You can keep responding to this one. I don't have another poll for you today, but I do want to show you the responses that I've received other times that I have asked these exact same questions. Now at 11 different events with over 500 people responding. And I found some trends here. This is hot off the python here. So there were some terms that were exclusively used to describe population, ancestry, and race. Interestingly, ethnicity didn't have any words that were used exclusively to describe it. It was either grouped with population or with ancestry. There were terms that were used to describe race and ethnicity or population. And then there were terms that were used to describe population, but group, interestingly, was never used to describe ancestry. It wasn't thought of as a group thing. Geography, it's not used to describe ethnicity, and shared wasn't used to describe race. So here are the data in table form, and the committee will have this in your slides later, or you can take a screenshot and ponder it. But the overall trends are that population is really considered to be about groups of individuals sharing geography, community, etc. Where populations are, whereas ancestry is considered really about family, genetics, history, and lineage, and race is very clearly considered to be a social construct that has to do with racism, skin color, and physical appearance of human beings. Whereas ethnicity is a little blurrier, has a little more slippage here with culture, also being about background, sharing some traits with population, with ancestry, and with race as well.
Alice, it's Anne. I just want to cue you in. You have about 2 minutes left by my clock.
Got it. So, all right, thank you. So we've been doing a lot of this work, as I mentioned, in ClinGen, the Ancestry and Diversity Working Group. We've been working with Elsie Hub to get some deeper insights from folks. We did a survey of clinical genetics professionals and researchers to find out how they felt about race, ethnicity, and ancestry. Most were not confident at all in distinguishing among them. They did feel that all three, race, ethnicity, and ancestry, were at least somewhat important for clinical interpretation of genetic variants. But interestingly, almost none of them actually had access to genetic ancestry information in the clinical setting. Fewer than 5% of our surveyed sample. So we asked them, if you do use this information, you think it's important, what is it? Where are you getting it? Well, as someone mentioned before, it is self-reported race or ethnicity by the patient, but 18% of our sample admitted, maybe it's more in practice, but 18% admitted that this information may be recorded by another care provider, possibly without asking the patient directly. So I think it was Nancy Cox this morning who said that this was done before. I think it's still done according to our work. So these are some of the recommendations that came out of the Ancestry and Diversity Working Group, which the committee can read later. But how might we do better? Well, I think what Graham said earlier is that we could match on genetics rather than on demographic categories. So we can actually, as the Pangenome Project is doing for genomic data, mapping variation across maps, we can do the same thing with mapping these demographic labels to the genetic variants. And happy to give more detail to the committee later. But I do have a research assistant, Abhishek Chozan, who's working on this. This is an interactive multidimensional map. It is in HTML and it's in beta version right now, so I won't show you live. But we have different layers of the graph that speak to different demographic variables, and you can link them all together using free text information rather than having the fixed categories. So in conclusion, population descriptors may have some utility, but they really need to be very clearly defined and justified when you're using them in genomics, that test forms are not harmonized in any way, shape, or form, that we might calculate allele frequencies as distributions across the categories rather than using the number of individuals in a category as the denominator, and then we could use graph-based reference data and multidimensional data maps for demographic data to harmonize across frameworks, global contexts, and to enable people to self-identify. So thank you to collaborators, mentors, and everyone here.